Imagine a future where popping an Ozempic microdose each morning becomes as routine as reaching for your daily multivitamin. It may sound radical, but that's exactly where some experts predict we're headed. And this is the part most people miss. The conversation isn't just about diabetes or weight loss anymore. GLP-1 drugs like Ozempic and Wegovy are being linked to a cascade of other health benefits. The real question, is everyone ready for this evolution in preventive medicine? How do these GLP-1 drugs work? Critics see this approach as overkill, but Dubrow counters, sugar's the enemy, and these drugs fight it. To understand the controversy, picture this. GLP-1s enable insulin to ferry sugar out of the blood and into your cells, where it fuels your body or gets stored. Plus, they help prevent the kind of inflammation and long-term damage sugar can cause to blood vessels, nerves, and organs. That's why patients at risk for repeat heart attacks, kidney problems, or even fatty liver disease, MASH, are seeing approvals for GLP-1 use. And here's where it gets even more compelling. The drugs are now under the microscope for possible cognitive benefits in Parkinson's, and some researchers believe their journey through regulatory approval has no precedent in medical history. But what exactly is microdosing, and why are younger generations, especially those on TikTok, so obsessed? Microdosing refers to taking a consistent, ultra-low dose of GLP-1s, even if you don't meet the traditional requirements for diabetes or obesity. Instead of the escalating doses used in diabetes treatment, you stick with a low, steady amount. Think half the normal starting dose, taken not weekly, but every 10 days. The idea? Maintain stable blood sugar, avoid spikes, and get protective effects against heart disease, even if your waistline isn't an issue. Now, let's address the elephant in the room. The safety profile of these drugs is still under active investigation. Common side effects include digestive discomfort like nausea and constipation. Some studies have indicated increased risks of pancreatitis or thyroid tumors, though Dubrow firmly believes these are rare or unrelated. Here's something that could spark debate. Dubrow says, I read every study and it's clear pancreatitis rates aren't higher. In fact, they may be lower in GLP-1 users. But not everyone agrees. There's still caution in the community. So who should be wary? If you have a family history of certain forms of thyroid cancer, you may want to steer clear. And if digestive issues crop up, most patients' bodies get used to it over time, especially with microdoses, which seem to cause fewer side effects. Still, anyone experiencing severe problems should talk to a medical professional immediately. Here's another controversial twist. What does Big Pharma say about microdosing? Drug makers like Eli Lilly and Novo Nordisk urge caution, warning that the practice of microdosing isn't supported by official FDA guidance and could introduce safety risks. The delivery method matters too. Pens are designed for specific dosages and shouldn't be tampered with. Should doctors be prescribing off-label microdoses? Or is this just another social media health fad? Access is another challenge. GLP-1 prescriptions are rising, but not all doctors are willing to write off-label scripts. Some people turn to online pharmacies, but Dubrow says this is a dangerous game. Rogue compounding pharmacies may offer adulterated or outright ineffective copies. If you don't know what you're getting, you're taking a risk, he warns. Looking ahead, pharmaceutical innovation is charging forward. New pills and injectables are being developed to address hunger and insulin resistance at once. Dubrow predicts that within 5 years, we'll see even more sophisticated treatments that could reshape how we view. Is it a revolution in preventive care? Or are we courting unnecessary risks? Share your take in the comments below. Would you try it or steer clear?